Today, my guest is Sam Yoshio with Connect3x, and today we are going to be talking about integrating total well-being with workplace performance to support a culture of engaged, thriving employees. So welcome, Sam. Thanks for joining me.
Thanks, Terry. Excited to be here.
Me too. The name of your company is Connect3x. I'm guessing that name was fairly intentional. So give us a little bit of background about your company and how that name came about.
Yeah, it is very intentional, very tactical. So Connect3x stands for connect with self, connect with peers, connect with experts. So connect three times. And we use that structure as a framework to help organizations essentially embed well-being into the rhythm of business. We focus on creating thriving organizations, right? So you had mentioned at the top, thriving organizations. And essentially, we understand that business is driven by people. Organizations and outcomes are driven by people. And how do we equip people with the tools and solutions to live more holistically in a way that not only improves outcomes within the organization, but improves outcomes in life? And so it's acknowledging the intersection that we've all faced in this work-life balance or harmony that we're all seeking, that was kind of amplified within the last 2 to 3 years.
Right. Yeah, true. It's funny because people my age and older, sometimes you talk to them and they're like, work-life balance. What is that? What is everybody all, I mean, it is a very different time. Not to say that, back 50 years ago, we shouldn't have been integrating some work-life balance, but it certainly is a focus, I think, right now. And, healthcare, the reason I wanted to talk about this with you is because healthcare, like many industries, is a really tough place to work, right? There's a lot of stressors, and we all go somewhere to relieve that stress. We all do something to relieve that stress. And sometimes it's healthy, sometimes it's not. And when it's not, that may mean ending up with a colleague that has a substance abuse disease. And that's why we're here today, to kind of talk about some of those things that maybe we can put in place to help mitigate that a little bit. Healthcare, it's tough emotionally. It can be tough from a scheduling perspective. It can be tough on a day-to-day basis. And it's a pretty high output that is needed. I was at a conference recently, and many of you listening actually may have been at the same one, where a speaker finished early and the moderator wanted to just jump right into the next speaker. And somebody said, "Can we take a bathroom break?" And very straight faced, but it was a joke, but we all got it. The moderator said, "No, we're in healthcare. We don't get bathroom breaks." And everybody in there understood, right? Because that is what it's all about. And I have actually, this could be a whole nother podcast, is funny things that have happened on bathroom breaks when you finally get away and take one and you're in healthcare and then everything goes wrong. But so, we laugh about it, but it's really very true. There are a lot of stressors and things. So how do we integrate well-being in an environment that can't even typically afford a bathroom break? So share with us some of the things that you do to work toward that culture that promotes well-being, and some practical things that can be done in a busy environment.
Yeah, such a great question with important context. So I think if you zoom way out, we zoom really far out first, the trends in engagement within the workplace have historically been going up. So the Gallup organization has been tracking employee engagement for a little over 2 decades. And since they've started tracking, it's been steadily moving up. That's the good news. The bad news is the actual number itself. So roughly 1 out of 3 employees are engaged in the workplace. And that's the high water mark over the last 20 something years was, I believe, 34, 35%. And that was kind of at the peak of COVID, where there was this unifying, galvanizing moment where people kind of locked arms and rose to the occasion. There's So there's this trend, but most recently that employee engagement number has started to decline for the first time in a long time. And so even I use the phrase work-life balance. I really don't like that phrase. I think that's a misrepresentation of how how people, employees, organizations um, could like the word itself or the phrase itself creates some problems. And so I always like to think of it in terms of harmony. Um, but if so, back to this employee engagement trend line, employee engagement has historically been relatively low. Um, on a global basis, it's even lower. Employee engagement globally is 16%. In the United States, it's 33%. And so we've always had these challenges of how do we effectively find connection in the workplace, or how 2 out of 10 employees feel connected to their organizational culture, right? And so I think there's an out there, not only from the employee experience perspective, but also from the leadership perspective, to start to unpack a little bit behind what's the why, what's the purpose of the organization. That's probably very clearly stated. But what I find in the work that we do is that that purpose that exists and that mission that exists and those guiding principles that exist up on a wall oftentimes just stay on the wall. They don't find their way into the employee experience. And so that gap between what the organization is holding themselves out as and what the employee is experiencing is an opportunity to bring um, more clarity, I think, to and the opportunity to connect the individual's purpose to the organization's purpose. And so I think at a high level, there's a tremendous opportunity that all organizations, all leaders have in this moment. It's kind of the silver lining of what we've gone through over the last couple of years, that there's this opportunity to recalibrate and reset. Down at a tactical level, what we really focus on are these 2 key points. The first two, connect with self and connect with peers, is how do we provide a framework for an employee to have the tools and solutions to essentially just take a moment, right? Understanding the power of a moment in changing the trajectory of a day, of a career, of a lifetime. And so, if you think about just moments, if any of the listeners or participants think of a moment in their career that has been a critical moment, a key inflection point within their life or within their professional dimension, their professional career, those moments always exist out there. And so it's kind of first providing that framework so that the employee understands that they have that agency. Because I think oftentimes we get so caught up in just the velocity of life, the pace of life, that we don't have that moment, or we don't feel like we have that control. We feel like we've got a list of 100 things to tackle and only time and energy for 5. So that awareness component of just being aware that I do have agency and control, and then threading that through why am I here? What's my purpose in being here, right? And so there is some interesting research that was conducted a while back that looked at purpose and passion, right? Those 2 words are often commingled. Like, I'm passionate about this work. It feels like this is purposeful work. But in this research, it was very defined, that passion was about the individual. Purpose was about something in service of others, right? So I'm doing this because I'm passionate about it. I'm passionate about healthcare. I'm doing this because I find purpose in helping lead toward better medical outcomes. And in this research, it was fascinating. So they looked at people who have low purpose and low passion, and on average, about 10% were performing at the right level, high performers even. On the other end, that's expected, right? On the other end of the spectrum, if you have high passion, high purpose, 80% there, performing at the level or performing above. Okay, that's expected. Those are both expected. Where it gets interesting is when you look at low passion, high purpose.
Okay.
64%, right?
Hmm.
64%. So somebody who doesn't feel like this is really scratching the itch for me personally, but I feel like I'm having an impact on others to improve this organization, to improve that patient's experience, to improve society at large, humanity at large, whatever that is, even though it may not scratch the itch, I feel like I'm seeing that impact in others. So I think that's a critical component of just the workplace in general, but in particular, one way that leaders within organizations in the healthcare industry can help reinforce or remind their employees that you're connected to something that is having an impact, right? It's bigger than
Sure.
self.
Hmm. Yeah. No, that makes sense. I mean, purpose, that is, I think that's in life in general, right? When we start feeling purposeless, then, yeah, things start to go the wrong way. So purpose, and certainly having purpose in healthcare should be a fairly easy message for employers to put out there.
Should be, but I think we all kind of get wrapped up in just the day to day and these kind of bland statements that come out from an organization that just don't connect
Hmm.
to the individual.
Hmm.
Right? There are these statements or these phrases that just float out there that I think the best organizations are those that do an effective job in linking the mission of the organization, the purpose of the organization to the individual and their career path. And so there are a number of different ways to do that. But I think that's the recipe that we've observed in terms of getting improving the employee experience in a way that's meaningful. The other side of this is also connect with peers. One of the questions that feed into the employee engagement survey that Gallup has been running for 20 something years is do I have a best friend at work? It's probably the most controversial question that's in this survey because historically it's always been like, well, I have my work and I have my home, right, or my life, and we don't want those two worlds to ever intersect. Oftentimes that's how we think of it in terms of silos. And as soon as COVID hit and we were in experiences like this, in most cases, probably many of the participants in in your industry didn't have as much of a luxury to dial in virtually, but there was this whole new side that we saw of everybody that shed a lot of light on who is that person beyond the person that comes in at 9 and leaves at 5. And so this idea of connecting with peers is really built around the fact that we're pro-social. We're human beings are wired for connection. How do we create cultures of belonging? And how do we identify opportunities for people to have meaningful connections that not only provide um, support and accountability for what I'm responsible for, but also gives me a bit of um, of a foundation for when I'm going through tough moments that may lead to poor decisions, right? Poor decisions. So in terms of diversion, if I have a quality relationship at work that is trusted, it's built on a foundation of psychological safety, uh, I may have that opportunity to voice that concern to a peer, to a friend, not necessarily within the reporting structure, but just to somebody that's willing to listen and to be there
Hmm.
to support. That may be a key moment that would change the trajectory of my decision making in a positive way.
Do you have suggestions on how to foster those peer relationships? I mean, sometimes they happen naturally. Some people are more prone to sharing their feelings and then making friends, where others are maybe more quiet to themselves or busy lives. You know, I come to work, I don't have time to go out with you after. I got to get home to the family and what have you. So, do you have any suggestions on how to be proactive with that?
Yeah, so a couple things come to mind. So the first is just establishing a foundation within the culture of the organization that identifies talents, values of the employee, right? And so if I, um, So we leverage a lot of strengths-based positive psychology. So we'll leverage the Gallup Strengths Finder or Clifton Strengths assessment. And so in that assessment, we may find that one of your top 5 themes of talent is strategic, and I have strategic as well. So just that simple notion of we have something in common, now that forges a bridge for connection, right? So that's something really simple. It's something really subtle, but it is something that can create a universal language within an organization that provides a bridge for people to rally around.
Mm-hmm.
So there's that side of it. There's also the side of creating or embedding these well-being experiences into the rhythm of business. So what we really focus on are micro moments. We acknowledge that people are very busy. They have really good intentions. Most people have great intentions, but our ability to implement is very difficult. So we focus on micro moments, and in particular going as far as 1-minute experiences that are science-based, that are really designed to help provide that moment for the individual to take a pause and kind of recast the trajectory, and potentially a moment for peers to connect in a 5-minute increment, so that if we know, so we've looked at research that's probably less directly in the healthcare space, maybe within the administrative side of the healthcare space, but just there are kind of 5 key points throughout the day, throughout the workday. If we know that there are different emotions or different mindsets throughout those 5 courses of the day, and we have that ability to insert one of these 1-minute micro moments at a key inflection point and say, hey, we're all busy. Let's just take 5 minutes to go through this micro moment experience. That now forges this connection. And it also provides me with that ability to kind of get my executive functions back forward, maybe pause in the chaos of the day. And now we have a touch point. So Sam and Terri are now 2 days later, and we're talking about that somatic breathing exercise that we did for 2 minutes on Tuesday. And it just forges this other touch point, so that connection between those peers, or maybe those employees, has the opportunity to resurface at a future point.
So are those touch points something that's typically led by somebody in the organization to kind of, let's all, share one interesting thing about yourself, or let's all breathe, or is that what those are?
Yeah. So the third connect is connect with experts. And so we have a curated cohort of experts called the Purpose Partners that sit across 6 dimensions of well-being. So social, physical, intellectual, emotional, spiritual, and professional. And so there is a combination of everything from a registered dietitian nutritionist to a certified somatic yoga, mind body, executive leadership coaches, and they'll provide not only your more traditional coaching and expertise, but they also provide these micro moments and these micro practices that are a little bit more educational. The moments are more experiential, the practices are more educational, but we lean on those experts and continue to onboard more of these experts to provide this holistic bench of services and resources, but also bringing into a very digestible, accessible format.
Okay. So are they coming in to do these 1-minute things, or they're providing the leadership with ideas and suggestions on things to do in with everything else that they're doing and helping to lead?
Yeah, so currently it's virtual. It's all digital,
Okay.
all virtual. So it's a tech-enabled people platform,
Okay.
and we really anchor on the manager. So another point of research is that 70% of the employee engagement, is driven by the manager.
Sure.
Right. So oftentimes
Yeah.
people join organizations and they leave managers. And so if you look at the manager role itself, The manager role has a lot of responsibility. They're also probably the highest point of leverage within an organization to really affect meaningful change. So oftentimes you're going to have a weekly, bi-weekly, or a monthly meeting where that reporting structure comes together. So in that unifying point, we insert these micro moments and experiences, which is an important kind of implicit signal from the manager to the team that I do care about your total well-being. I'm going to carve out 3 minutes of real estate in a 60-minute meeting so that we can all get centered, get on the same page, but then also give you these tools so that if you want to be more intentional and build habit within your daily routine, you have access to these experiences, and also kind of on a situational basis. So if I look out at my calendar and I know I'm going into something that's going to be a little bit more emotionally charged, it's a higher stakes moment, or it's a conversation or a meeting with a peer that has been historically a little bit emotionally charged. If I can take these experiences and leverage them going into that moment or that environment, that ecosystem, it provides more tools to help mitigate the anxiety and stress that comes into that situation, and then ideally helps that individual be more intentional and ideally increase performance and increase outcomes.
Sure. Okay. Do, typical things in the workplace, like occasional lunches that you bring in, or, potluck that you do with the staff and it's in the break room, those types of things, would that fall into these buckets of creating those
Absolutely.
moments?
Yeah.
Okay.
Absolutely. So I think those points of connection play a critical role.
Mm-hmm.
I think there's typically more opportunity within those moments to
Do
forge
something.
those moments of connection, right?
Right.
Usually when we go to those potlucks, we gravitate toward the same kind of 2 to 3 connections that we always gravitate
Sure.
toward, which isn't necessarily a bad thing.
Mm-hmm.
But how do we create that that interconnectedness within an organization where you make
Really
or encourage
maximize
two
it.
people to connect? Yeah.
Yeah, to really maximize it. Yeah. Secret Santa, done that too, which is some interesting things. Going, what is this? Yeah, yeah. Do you have, and maybe this is not a fair question for you, but people have attitudes, and you talked about that a little bit in preparing, but if you're in a team situation and you've got those people with those, like, this is stupid, attitudes, kind of bringing the whole team down. Do you guys also work with that, or have any suggestions on those naysayers to get them, like, come on, give it a try?
Yeah, and unfortunately, there's a lot of that, right? I mean, back to those engagement numbers, that's about 16%. So 16% are on the other end of the spectrum, where they're showing up and they're actually intentionally leading toward negative outcomes in the organization, and then everybody else is just kind of in the middle, where they're doing just enough, right?
Right.
So with those people, I think there's an opportunity for intentionality with the manager, right? And it's such an easy thing to say, that how can the manager kind of step in and have that conversation. A really important framework that we leverage is back to this agency concept, and it's a concept called job crafting that some people may be familiar with. That the narrative that supports the research is often comes through in a large hospital, I believe. So 2 researchers had identified that there was high satisfaction within certain groups and low satisfaction within the same group. And in particular, it was in, I believe, janitorial services in a large hospital. And so they saw the research, and there was just this group that was really highly satisfied in their job, and then those that had experiencing low satisfaction. So they kind of went to the conversations. They wanted to find, well, why? why are you experiencing high satisfaction? Can you tell us some more? And so the three quick stories were, the first was, there was a janitor who had noticed, kind of had on the radar when there were patients that didn't have visitors and that were kind of experiencing some loneliness. So that janitor would intentionally go into the room multiple times a day to strike up conversation, check the trash can. Oh, nope, nothing's still in the trash. Well, how's your day going? How's everything going? Okay, great. And then they leave. Right. So they were intentional about what they were doing there. The second was there was a janitor who worked on a coma patient floor and was under the idea, was under or believed that if they would go in and disrupt the room somehow, turn on the TV, turn off the TV, move a magazine, that they could be leading toward positive outcomes for that particular patient. The third story was, there was a janitor who had noticed that there was a patient who had elderly visitors, and became very distraught when the elderly visitors left because they were worried that the elderly visitors were going to get lost in this labyrinth of a hospital. And so the janitor eventually stepped in and said, patient, don't worry, I'm going to walk them to their car. And so, as probably everybody here knows much better than I do, that if you can't walk anyone beyond the doors of the hospital, because that introduces liability to the organization. But this janitor made the decision to walk them all the way to their car so that the janitor could go back and look the patient in the eye and report back, don't worry, grandma and grandpa made it to the car. Okay, I saw them, waved to them goodbye. And so the researchers had asked, well, why do you do that? You introduce liability to the organization. That's grounds for termination for you. Why would you do that? Is that part of your job? And the janitor responded, it's not part of the job, it's part of me. And so what these researchers talk about are task crafting, relationship crafting, and cognitive crafting. And the collection of those three is this concept called job crafting. And so task crafting is, if you look at a job description of what you do on a daily basis, there are some things that give you energy and there are some things that just suck the life out of you, right? And so just acknowledging that, having awareness of there are these and there are those, and that manager, back to this employee, that manager can open up that type of conversation. Mm-hmm. So let's talk about those tasks that really you enjoy and those things that you don't enjoy. And what the manager may find is there is someone else on the team that has the exact opposite, right? So there can be kind of like a swap meet type of task thing that, hey, you really like this and you don't like that. And what if we kind of re-engineered what we're doing? The relationship side of it, relationship crafting, it's the potlucks. It's when I go into work, even if they're not on my team, there's someone that I just really enjoy seeing and connecting with. And then cognitive crafting, I think, is where we all possess that power. Is, if I go in with the mindset that it's going to be a bad day, I'm going to find a way to bring that bad day to life. And so I think all three of those, from a manager's perspective, opens up that opportunity to draw awareness to that employee that's kind of eye rolling, just arms crossed, and really doesn't want to engage, and have a very meaningful and authentic conversation around, all right, let's talk about the tasks that give you energy. Let's talk about the relationships that give you energy. And then let's talk about the mindset and just help them work toward the first two, which the number three, the cognitive, will largely, I think, start to take care of itself. It'll become a byproduct of realizing, I do have some tasks and relationships that are quality and important to me. And I also have a manager that's really starting to empower me or lead the way in terms of creating my roadmap.
Right. Yeah. These are all great things, and certainly things for managers to think about and dwell on, because they do get a little overwhelmed with everything that they have going on too. And it's establishing those relationships. And I think first to truly care and to want to make, the place a better place. You'll appreciate this one quick story. So I was managing a pharmacy, and really, I mean, I do take the approach as much as possible. I want to hear from you. Let's see what we can do. And so I was having one of those discussions with one of the pharmacy technicians and really trying to figure this out. This had been going on for a little bit, and there was a particular issue that was bothering her, and I couldn't much see a way around it, and quite honestly thought she was getting a little bit over the top. And so she came in one day to express herself again, and I rolled my eyes, which she caught. She saw me do it, and she stopped, and she said, "Did you just roll your eyes at me?" Like, dang gummit. I'm like, "Yeah, I did, sorry." It's like, I've been trying so hard to get this to work for you. I'm done now. I can't do it anymore. But yeah, all good things to.
We're human. We're all human.
Yeah, she
right?
nailed me, man. So
Well, how did you rebound? How did you rebound?
I just apologized. I said, "You're right. I shouldn't have done that. I'm trying to find a way to help this situation, and there are so many factors at play, and right now I can't come up with anything. So, we'll continue to talk about this. We'll continue to explore it, but I just had to own it."
It's tough. I mean,
Yeah.
We're all human. We're all human.
Yeah. So on that note, thank you very much for sharing. This is some good stuff. I think it is stuff that we do need to think about. And I know from my experience, when I am a staff member at a hospital, the engagement is different than when I got into management. And I think that was because I started hearing more. I started being involved more. I started understanding the background more, which is why I am a big background person. It's like, let me tell you why we're doing this. And then that way we can ensure better success, or hear from people as to, well, that's not going to work. And so I think that's what has made a difference to me. And so I can see how that would make a difference to employees, is get them more engaged and share with them what's going on, not just do this, do that, without that, background and feeling connected. But this is all great stuff. So thank you very much for sharing with us.
Yeah, absolutely. Just one more point, just to amplify what you just said right there, for managers and for organizations in particular. I think a good analogy is like Netflix, right? We all have a different Netflix screen, and that's based on actions and behaviors. And so for if managers or organizations think of all their employees, like, there are different experiences that they need that are going to be unique to them, that's going to bring out the best in them. That's an opportunity to connect that individual purpose to the purpose and mission of the organization.
Yep, absolutely. Yep, very true. All right. Thank you very much, Sam. You have a great rest of your day.
Thank you, Terry. Thanks for having me. Appreciate it.
Absolutely.